today's post we're going to be talking about one of the tools that we use to help people, particularly with people that have chronic pain or even acute pain, whether it be neck, back, shoulder, hip, knee, plantar fasciitis. It's a tool that we use called cold laser. I've had a few calls in the past few weeks about cold laser and how it works and people inquiring. So I figured I'd make this short video to kind of just give you a brief overview on how it works. So basically laser, I'm just going to turn on the laser. Hopefully you'll be able to see it on our whiteboard here. But the idea is that laser is a coherent light. It's one frequency, and in the case of what we mostly use in the office, it's either red or infrared. There's no radiation. It's harmless in that we don't do it on pregnant women. Basically, that's our one contraindication. We don't do it on that. But it can be done on kids and elderly people. There's really no contraindication to the process because it's light therapy. And what the light does, and what research has shown, is just like any cell in the body has receptors on it, or these satellite dishes that are receiving information. And a lot of the reception that people think about, if it's a satellite dish looking for insulin, it's basically looking for a chemical message. But in the case of light, there's actually photoreceptors on every cell. In other words, it's looking for photons. They actually take in photons, these cells. All cells have them. And as a result, if the light's coming into the cell, it's going to set off some other messages that go into the cell and tell the cell to make more ATP. ATP, adenosine triphosphate, is the energy molecule. Every cell needs it on an ongoing basis to do its work. If that work, it means it needs to produce hormones to be distributed to the rest of the body. That's what the ATP is used for. If it's a nerve cell, the ATP is used to maintain the messages that are being transmitted along nerves. ATP is used for everything. Now, when tissues get damaged, so if we're going to limit this conversation to how we use it to help pain, then the idea is if the more ATP there is, the more work that cell can do, and the more work can be done to help repair tissue. So that's the idea of what we use laser for. And in essence, when it comes to pain and how we work it with the nervous system, because as a chiropractic physician who works with functional neurology, I'm very interested in the nerve system and how it's working. So when it comes to pain, you have basically two types of nerves that are going to be involved with this type of therapy. And you have nerves that deal with pain, and you have nerves that deal with mechano or proprioception. In other words, where is a joint or a muscle in space? Where is the position of that joint or that limb? Where is the length of the muscle? How is it doing? And they need to be firing at an equal rate. In other words, they need to be equal. And when the mechanoproprioception, the awareness of where a body part is in space, those nerves are firing at a frequency that's at a certain level. And if they're matching those other types of nerves, in other words, they are inhibiting the pain nerves. That's the job of these things, is that's what they are doing. They're squashing out so that you don't feel pain. But what happens is that these nerves start to misfire and start to lower, then the pain is going to start to come out. So what we do with the laser a lot of times, we find specific areas on the body where we can upregulate the muscle's ability to fire around a joint so that the pain can actually be modulated down. And that's how laser can help a person feel better. So this is how we use some of the techniques in laser. There are other lasers we have, infrared lasers that we just point and shoot on an area that's been damaged, like an area that has plantar fasciitis on your foot, or an Achilles tendonitis, or a tennis elbow, or a shoulder rotator cuff problem. We can use laser also just to maintain or decrease that inflammation down. We can also use laser to stimulate acupuncture points. You don't have to use needles. You can use light. You can use electricity. You can use pressure. You can use different modalities with acupuncture. Acupuncture is not, it's a theory. In other words, it's a principle, I should say, and that is, those points can be stimulated in different ways, and laser is one of them. So that's how we use laser. If you haven't had a chance to have laser therapy, it's a very good alternative to other things. It's actually, I use it as a first-line therapy for a lot of different things because it's so effective, and I've been using it in my practice for the past 7 years. So I hope you like this information, and I look forward to talking to you in the future, and make it a great day.